Hi, Assalamualaikum. My name is NURUL Umairah binti Abdul Salam. My MATRIC number is 1213037. So today I will present to you about ergonomic risk factors and risk assessment in construction industry.
In this presentation, I will explain to you what is ergonomics, ergonomic in construction industry, ergonomics risk diseases, ergonomic risk factors, ergonomic risk assessments, initial era and advanced era.
Okay, I will start my presentation by discussing what is ergonomics. So basically, ergonomics is the science and practice of designing jobs and workplaces to match the capabilities and limitations of the human body. So basically, the goal of ergonomics is to create jobs, tools, equipment and workplaces rather than making people adapt to them. So ergonomics will refer to the study of designing safe, productive workplaces, work habits, workflows for the workers in order to eliminate the risk factors including sprain, many disorders, and to assess the risk level for tasks related to work. Okay, next we will diminish our scope to focus on the ergonomic risk factors and assessment in construction industry. So as we know, the construction is defined as the building of something, typically a large structure where the nature of the work imposes a lot of ergonomically hazards to the workers. So it is considered as a demanding job where a large number of workers are working and often classified as a high-risk industry. So construction industry is a dynamic and hazardous industry, making it challenging for ergonomic aspects to be implemented on site. Thus, there are a lot of controlling factors that can be taken into consideration in implementing ergonomics and controlling ergonomic risk factors in the construction site. So after this, I will discuss one of the major risks that commonly construction workers have. Okay, construction industry is a profession that usually uses their body parts to do work because MSD are the most prevalent disease that normally occurs to construction workers, and the percentage of the workers to get MSDs is relatively high. So actually, what is MSD? MSD or musculoskeletal disorder are injuries and disorder of the soft tissue in the body and nervous system. So soft tissues include the muscles, tendons, ligaments, joints and cartilage. So actually MSD can affect the nerves, tendon, and most frequently it will attack arms and back. Okay, for example, one of the most popular ergonomics diseases that relate to the construction industry is carpal tunnel syndrome, tendinitis, trigger finger disc injuries, tension neck syndrome, and Raynaud's syndrome. After this, I will discuss one by one each of the listed diseases that I mentioned just now. Okay, firstly, I will explain about carpal tunnel syndrome. Actually, it is a nerve entrapment result from the build-up of pressure on the median nerve for the construction workers due to carrying of loads and gripping for a long time. Okay, so actually you feel numb, tingling or pain in the hand, especially your wrist and forearm. As an example, here, you will feel pain here and you need to do like this. Okay, or maybe you need to pour oil on it. Okay, so next is tendinitis. Okay, it is actually tendon inflammation occurring when a muscle or tendon is repeatedly tense from overuse or unaccustomed use of the wrist, shoulder or knees. So where's the body part involved? So maybe here, or maybe at your knees, or maybe here. Okay, after that, one of the diseases is trigger finger. It is a type of tenosynovitis arises due to flexing of finger frequently against resistance. Maybe when the construction workers need to do overhead work and need to use tools. Of course, he will do like this. So yeah, maybe this is one of the factors commonly happen to them. Okay, so next, not only that, these injuries also happen to them. So actually, it is a damage that occurs to the disc on the spinal cord due to frequent bending of back. So as we know, spine runs from the top of neck down to your lower back. So and the pain maybe occurs on your waist because of the bending. After that, tension neck syndrome. I believe that not only workers in constructions will have it because even us experience it, right? And what is actually? So it is muscle strain that results from long periods of looking up like this. Okay, so it can cause neck stiffness, muscle spasm and pain in the neck or radiating from the neck. So you will feel pain here and you will do like this, or maybe you will do like this. Okay. Okay, lastly, Raynaud's syndrome. Yeah, it is one of the popular diseases to them, but not for us. Okay, so what is Raynaud's syndrome? So it happens when blood vessel of the hand is damaged from repeated exposure to vibration long period of time. So the skin and muscle do not get the necessary oxygen from the blood and eventually die. Okay, for example, when using tools, there's repeatedly vibration like this, right? So, but actually, it is not good. So you will feel numb at your hand and it will just like melekor pucat because lack of blood flow, and after that it will become blue because lack of oxygen, and it will become normal when blood flows returns. Okay, before this, I explained the ergonomic risks involved in the construction industry. So now we will proceed to its factor. One of the popular ergonomic risk factors happen to construction workers are lifting and handling materials, overhead work, stooping, bending and kneeling, and lastly, hand-intensive work. Okay, firstly, I will explain about lifting and handling materials. Okay, lifting and handling heavy and large materials puts a lot of pressure on the back, shoulders and neck. Heavy object can dig into a worker's hand and impede circulation. So holding them for an extended period of time can lead to conditions such as tendonitis or carpal tunnel syndrome that I mentioned just now. So the solution that can be implemented are, firstly, provide mechanical, hydraulic or vacuum lifts to handle window frames or drywall panels. Next, provide mechanical lifts or carts when handling large and heavy objects such as barrels. Lastly, use skid teeth to move concrete field hoses. A skid teeth makes the hose lead on the rebar, reducing the amount of force required to move them as well as the sudden movement required when the hoses get caught. Okay, next I will explain about overhead work. Overhead work creates substantial stress on the shoulders and arms. Working with your arms up is never comfortable like this, okay? Especially repetitive motion, forceful grip on tools and twisting the body, and you've got significant potential for an MSD. So the solutions are add elevated work platforms because it will provide a stable working surface that reduces the need for awkward postures while also eliminating the risk associated with ladders and scaffolding. Next, extension poles for powder actuated tools will help to avoid the exhausting work performed with hands above the head. So like this. Okay, so the extension pole might also eliminate the need to work from a ladder, which is also strenuous. Okay, so lastly, extension shaft for drills and screw guns will allow workers to perform overhead installation while keeping their hands at waist level. So the employee can push with their bicep instead of their shoulder, which is a less strenuous position. Okay, next, the ergonomic risk factor is stooping, bending and kneeling. Okay, as we know, construction work can involve a surprising amount of stooping, bending, kneeling and even squatting for a extended period of time. Workers who are tasked with fastening or connecting construction materials are especially likely to spend a lot of time in these awkward positions. So one quick solution to this problem is to ensure workers are provided with tools that allow them to perform their work in an upright position. So how? Firstly, kneeling creepers with cushioned knees and chest support will reduce stress on the knees and back when installing tiles or deck membranes. And please do it without Velcro or leather strap that can interfere with blood circulation. After that, split level adjustable scaffolding will help to keep the bricks at waist level when doing masonry work, which reduces the need for stooping. Lastly, auto-fit screw guns with an extension to assist workers in securing subflooring, forced floors and decking and roofing materials. Okay, lastly, hand-intensive work. Employees in construction spend a lot of time gripping tools and materials, which places a lot of stress on the hand, wrist and elbow. In time, this can lead to serious muscle or joint injury. So thankfully, there are solutions that will reduce this risk. Firstly, easy hold gloves for mud pans are a great way to reduce the hand force required to hold a drywall mud pan. So the glove attached to the pan and hold it to the employee's hand without needing a forceful grip. So this will eliminate a significant amount of strain. Next, use power brushes instead of hand wire brushes when clearing rust or other materials. Power tools reduce the need for a forceful grip as well as repetitive motions. Okay, now we will move on to the last topic, that is ergonomic risk assessment. So in Department of Occupational Safety and Health website, the committee already provided the guidelines for employer and employee about ergonomic risk assessments or ERA. So the figure that I show on the slide is the process of initiating ERA, because ergonomic is related to the objective of Occupational Safety and Health Act 1994, that is to promote occupational environment for persons at work which are adapted to their psychological and physiological needs. It shall be a duty of the employer to provide a safe and healthy workplace for their employees and persons other than their employees. Okay, so ergonomic risk assessment involves a process from planning, assessing and controlling. So as we can see, it started with the blue diamond one on the left, that asking for whether ergonomic hazard and risk factors identified in the workplace. If yes, they will proceed to initial ERA. If the outcome result tells us to carry out an advanced ERA, so the employer should obey and proceed to the next ERA. Okay, now I will proceed to initial ERA. What is initial ERA? Initial ERA needs to be conducted after initiating an ERA in the workplace. For initiating ERA, the employer can have two approaches, proactive and reactive. So I believe that in construction industry, the employers usually needs to be assessed on the risk hazard and ergonomics. So initial ERA will always be conducted. Hence, as you can see on the slide, all of the listed is the assessment that need to be assessed in order to conduct initial ERA. Okay, firstly, musculoskeletal assessment should be conducted for all types of risk factors to identify and validate the affected body parts. Next, ergonomic risk factor assessment. It will depend on the types of ergonomic risk factor identified that I already mentioned above. Okay, next, forceful exertion. Consider the weight, material or force relative to the types of activities or the manual handling task. After that, repetitive motion and hand arm and whole body vibration is needed to pass all of the checklists. So, lastly, environmental risk factors evaluate using methods of interview, observation and measurement using equipment for a real-time assessment. Okay, next, this part will describe the process for undertaking an advanced ERA. So the result from initial ERA should enable a trained person to focus on the specific workplace that has been identified as having significant ergonomic risk factors. So the process is summarized in figure on the slide. As you can see, it contains 5 steps. Firstly, Step 1. Option a summary of findings from initial ERA, identify the control measures implemented and assess if the existing control measures are adequate. This information should be included in advanced ERA report. If additional information is required, go to step 2. If information is sufficient, proceed to step 3. So for step 2, we need to obtain further information for advanced ERA such as history of IMSTs, origin problem, medical records of relevant document. Step 3, a trained person should select the appropriate method for specific risk factors. So the factors that may include is from the information that is mentioned before. Okay, for step 4, summarize the finding of advanced ERA. So the multiple risk factors, the result should be summarized together. And lastly, for step 5, ergonomic improvement based on every assessment in step 4 should be implemented in step 5. Okay, so that's all from me. Thank you for listening to this topic, that is ergonomic risk factor and risk assessment for construction industry. That's all from me. Thank you.